This Studio Sacramento episode is supported by UC Davis Health, where doctors, nurses, and researchers share a passion for advancing health. Learn more about their latest medical innovations at health.ucdavis.edu.
The rising number of seniors has been called a silver tsunami that is impacting a growing number of families caring for their aged loved ones. The UC Davis School of Nursing's Family Caregiving Institute provides support and training that can be a lifeline to caregivers. Executive Director Terri Harvath and family caregiver Nancy Pennebaker join us today to talk about caregiving and getting the support our loved ones need. Nancy, tell us how you came to be a caregiver.
Well, my husband and I were enjoying our retirement life, and it became apparent that his memory wasn't as good as it used to be. And my family and I decided we ought to get my husband tested. So it was several years ago that he was diagnosed with cognitive dysfunction. And from there, we decided to move from a rural area closer to medical care and near our family. It started on a kind of slow beginning, and then it kind of took over. And I said to my daughter the other day that I'm no longer retired. I didn't realize it, but I now am a full-time employee, and it is very time-consuming.
You know, when you talk about how you've gone from retiree back to a full-time job, can you share with us further, how did your husband's condition and the change in your life impact just, your day-to-day?
Wow, that's a big question. It impacts everything. I know that when I heard the diagnosis and began to understand what the impact was, it was very alarming and sad to me, because I realized it was the end of the marriage that I knew we had for 40 years. And
Nancy, I'm going to ask you for just 1 second. That's an incredibly powerful statement, that it was the end of the marriage that you'd had for 40 years?
40 years.
40 years.
Yeah.
Tell us exactly what you mean by that.
Well, what I mean, and what is hard to explain to someone like a good friend, what it actually means, and the significance of it is, I no longer have a partner that I can talk with, that I can run ideas by to help me make decisions, or to get decisions in agreement with my husband. We had a wonderful marriage, and we were very collaborative and strong partners. And it meant the whole day and our whole life was completely different and going away from what I knew. So the future was very unknown, and it was very, as I said, alarming. I really didn't know what to do, other than I just knew that I wanted to take good care of him and to make the time that we had together as best as I could.
Terri, when you hear Nancy's words, in there you hear loss, uncertainty, a lot about the unknown. As a practitioner who's worked in this field for a very long time yourself, how unique is her experience with regards to this, and with regards to how the other families that you see are going through as well?
Thanks, Scott. Unfortunately, it's a really common experience that Nancy and other caregivers have, particularly when they are caring for somebody who has dementia or other forms of cognitive impairment. because what happens is that the disease starts to rob that person of their personality, of who they had once been. Their memory is impaired, their ability to understand the continuity of their lives together is interrupted. And so we often talk about that in the context of dementia, family caregivers experience pre-death grief, because even though her husband is there, she's losing part of her relationship with him. She's losing him, and that represents a significant loss.
Is that always appreciated by the family members, friends, and community that surround people like Nancy and her husband? Is it appreciated in the way it should be?
I think it often is not, in part because Nancy and other caregivers do a really good job of protecting the person they are caring for from the loss of dignity that their impairments result in. And so she is, and Nancy and I have talked about this, she, sort of covers for him and protects him so that friends and neighbors and other family members are not as keyed into the full extent of his cognitive impairment. And I think it's also when you live with someone on a day-to-day basis, you really see the small changes that add up over time. And so, until you experience it yourself, I think it's really hard to fully appreciate just how devastating the loss is and how significant and extensive that loss is.
Terri, that is just so true. When it first happened to me, I have a lot of close friends that I'm very close with and my family. And I completely expected them to react as I had reacted, a death. And it's just not understood unless you go through it. It's a very significant change. And it's because it's not recognized in the degree of its significance. It's another problem with your isolation and your feeling lost. You lose your sounding boards. You lose a connection because it changes relationships.
Does it ever lead? Oh, please go ahead. Go ahead.
I was going to say, it's not unusual with dementia for the person's social skills to remain intact. Mm-hmm. And that can cover a whole host of impairment because the person is able to respond, picking up cues. I think there must be some survival benefit from that, where you don't look like you are as impaired as you are because you manage to pass in particularly, fleeting social interactions. And so unless you have greater depth of contact with that person, you may not really be exposed to the full extent of their deficits.
When you're talking about Nancy, how it is that, those around you are receiving you, is there any sort of lack of understanding or even resentment that happens because they expect you to be available in the same way, to essentially have the same sort of lifestyle or pacing in terms of the activities you're involved with, that sort of thing? And that leads to issues?
That's exactly what I was going to say, that it reminded me that, number one, a response that was very troubling to me was that I had people that wouldn't believe me. That they would say, "Oh, I just saw your husband. There's not anything wrong. What are you talking about?" Which was just devastating to me because it made me feel, first of all, am I imagining this? I know I'm not. It's, there on the paper. But there is a lot of resentment because, and frustration. In essence, it's not being listened to. And it does cause some anger and some guilt, and maybe I shouldn't have said that, maybe it's like gossiping or something, because social skills are are hard to pick up on unless you're with someone all the time. You don't notice memory loss and things like that unless you're living with someone, at least in the beginning.
Terri, I wanted to ask you, I referred to a little bit earlier to the silver tsunami. Give us a sense of the depth and breadth of what we as a society are facing with regards to the demographic changing, leading to more and more family caregiving.
Mm-hmm. Yeah, it's unprecedented in history, really, what's happening demographically in this country, but really across the world. We're seeing in this country 10,000 people turn 65 every day. This has been going on for over a decade and will continue for 2 more decades. And it's unfathomable. And it's not just that we have unprecedented numbers of older adults. At the same time, the number of younger adults is decreasing in proportion to the older adults. And so what that has resulted is an increased likelihood that most of us will be involved in caregiving for an aging family member at some point in time over the course of our lives.
Give us a sense of that decrease that's happened over the years in terms of how many aged people are alive compared to the number of people that are younger that can care for them.
Yeah, basically in 1950, you had a 3% chance of being a family caregiver. So for every 100 people who were the age of caregiving, there were 3 people who, needed help. By 2030, that's going to go up to 30%. So we'll have a 30% chance of being a caregiver. And we're looking at, even currently, 50% of households are involved in caregiving in some way. So you may not be the primary caregiver, but you may have someone in your family who's assisting an older relative in some other supportive way. So it's become this normative event for adults to be engaged in caregiving. And it's one that we don't really prepare ourselves for, and we don't do a good job of preparing caregivers for the role that they've been called to do.
Nancy, based on Terri's words, it sounds like that you are part of a growing community, yet at the same time, very much alone.
Mm-hmm. Yes. It's a very odd kind of environment because I'm very much alone and yet I'm very needed all the time. So I don't really have time to think things through until maybe the middle of the night when you wake up and you start to worry. I think the fact that it's very difficult to understand the impact on a caregiver. There's so much attention, obviously, and rightfully on the one who is ill, because other people are going through a little bit of understanding their friend or their father or their grandfather is changing. But I think as a caregiver, the needs are really significant, and it makes a big difference if you have just anyone who understands and who can provide help and actually be a cheerleader. That's the thing. Terri is just amazing and has literally changed my life in the sense that she's my cheerleader. She really encourages me. I'm for once, my needs are very important, because if I don't take care of myself, which is a common thing for people to say, you can't take care of the person that you want. You can't be a mom or a wife or a sister unless you yourself, me, is rested and feels that just normal, everyday kinds of things that you used to need can still happen.
What has the Family Caregiving Institute meant to you, Terri?
To me, what has it meant? Oh my goodness.
Nancy, I apologize.
Go ahead.
Nancy,
Oh.
what has it meant to you?
It's meant everything. So I spent a good 2.5 years struggling on my own. And I was having trouble in the medical community getting understanding, even for my husband, and the coordination between doctors and pharmacies and everything, it was a mess. So not only was I dealing with what the needs were daily for my husband, but it was always a catastrophe that I had to fix that just wasn't working. And so someone recommended this new program. And I went into the center with my husband, basically to find some place where one person could take care of him, and then from there coordinate the stuff that he needed, because there was no coordination, and that was beyond what I could do. And so I went in, and it was amazing. And his gerontologist is a wonderful person at the center, and she began taking care of my husband and bringing in all the different things that were needed, and mistakes were not happening anymore with the pharmacy and that kind of stuff. But I think it was the second time I was there, Dr. Chukin said, "What about you?" And she said, "I think I know kind of some things that you might need, and I have the perfect person here at the Institute. Are you willing to talk about it?" And oh my goodness, my first meeting, I have to say I was exhilarated. I walked out of the center exhilarated, because I saw that on a daily basis, there were very professional people that could take care of my husband and his needs. But then there was also so much support for me. And I realized that what I'm in now is an experience that I can enjoy and welcome, because I can learn so much. And I have to tell you, things I've tried to work on because of who I am my whole life, I've figured out and I can handle now, because they pop up with taking care of my husband. And so, I figure out, how am I going to help him? And then I go, oh, I could do this in my whole life, not just with my husband.
That is
so
wonderful.
I'm learning so much.
That is wonderful to hear.
Yeah.
And Terri, I want to ask you, Nancy's experience sounds wonderful. Give us a sense of the full range of support services that the Institute provides.
So this is a new area for us that has started just in January with UC Davis Health's new Healthy Aging Initiative. We opened a new clinic to focus on the care needs of older adults, particularly older adults with dementia. And I knew right away when I started working on this initiative, it was an opportunity for us to provide direct care services to family caregivers as well. And so right now I'm seeing caregivers 1 day a week in clinic to understand what their concerns are, try to connect them to resources that they may need. We're looking at developing support groups when we go down the line. We also are hoping to be able to develop some classes that we can offer to family caregivers to learn how to do some of the challenging care activities that I went to nursing school to learn how to manage. So incontinence, dressing changes, injections. We ask families to do all of these complex care tasks, but we don't do a very good job of giving them the instruction and the support they need to develop comfort in performing these complex care tasks. And so this is an area that we hope to be able to expand over time. One of our nurse practitioners is going to
You have been working in this field for over 40 years or so? Over 40 years or so. How have the needs of the aged and their caregivers changed over time?
I think that we are doing a little bit better job now in recognizing the important role that family caregivers play in our healthcare system. I still think of them as the invisible member of the healthcare team, because we often don't value what they know and can tell us and the role they play in enacting any of the care plans or treatment plans that we develop for older adults. I had an opportunity to experience that on a very personal basis at the beginning of the pandemic. My partner was in the hospital for the full month of March with complications from cancer. And when the pandemic, this was March of 2020, and when the pandemic struck, hospitals across the world banned visitors, but made exceptions for parents of minor children and partners of pregnant women, because we understand that parents are integral to care of children and partners for pregnant women. But no such exception was made for family caregivers for frail older adults or older adults with cognitive impairment whose well-being depends often on having a caregiver there. And, you know, I got kicked out of the hospital for about 18 hours until I was able to pull strings and claw my way back in. I was an exception. And let me just say, this was not at UC Davis Medical Center. But it really affirmed for me just how invisible and how we are dismissive of the role that caregivers play. And even though we now are recognizing that we rely on them, we don't always have the right skills in partnering with them the way that I think it would most benefit them and the older adult they provide care for.
How does one, who and how do you access the services of the Institute?
Right now, we're still in startup phase. And so we are taking referrals from patients who are already connected to UC Davis Health. And so if you have a primary care provider within the UC Davis system, ask them to make a referral and we will get you on the schedule. And I'm hoping that we will see a large increase in demand for this so that we can continue to grow these services, because I think that they have the opportunity to play a valuable role in supporting caregivers. You know, Nancy is remarkable in her resilience and her capacity to use the coaching and the discussions that we have and put them immediately into operation in caring for her husband. Other caregivers have struggled with that. You know, I'm always humbled when I meet with caregivers to understand all the complex demands that they are managing. And that has been so much worse during the pandemic as they've had children at home. They've tried to also be involved in educating them. Services dried up, so they didn't have any kind of respite or help. And I think it really highlighted just how fragile our healthcare system is in managing and responding to the needs that older adults and their caregivers have.
Nancy, in our final moments, can you share with the people who might be watching this conversation and are still shy about reaching out for help, anything that might help them reach out and connect with the help that could impact their lives the way that Terri and the resources of the Institute have impacted yours?
I think
very quickly.
Yeah, I think it is difficult to quote ask for help. I kind of fell into it, but my suggestion is there's so much out there that is positive and pleasant and good for you as a caregiver. And if you can find a person to counsel with, like Terri and a program that the University of California have, it will make a huge difference in terms of the time you're spending on this journey with the person you're caring about so much.
And I think we'll leave it there.
Okay.
Thank you both for sharing your stories and your work with all of us.
Thank you,
So
Scott.
thank you.
And that's our show. Thanks to our guests and thanks to you for watching Studio Sacramento. I'm Scott Syphax. See you next time right here on KVIE. All episodes of Studio Sacramento, along with other KVIE programs, are available to watch online at kvie.org/video.
This Studio Sacramento episode is supported by UC Davis Health, where doctors, nurses, and researchers share a passion for advancing health. Learn more about their latest medical innovations at health.ucdavis.edu.